Babies born alive before 37 weeks of pregnancy are called preterm birth. Experts say babies born too early, especially before 32 weeks, have higher rates of death and disability. Today on the program, we're taking a look at how to care for preterm babies. Good evening. Thanks for always staying with Lagos Television. You're watching Sound Health. I am Olasumbo Modupe. The conversation begins after this break. Please stay tuned. Well, the program is still Sound Health on Lagos Television. Thanks for staying with us. Joining us via Zoom from Abuja this evening is Dr. Nonso Epundu, consultant pediatrician, Zenith Medical and Kidney Center, Abuja. Good evening, Dr. Epundu. Thanks for staying with us.
Good evening, Modupe. Thanks for having me. Happy to be here. Thank you.
All right, Dr. Epundu, let viewers know what we consider as a preterm birth.
So thank you so much. Preterm delivery or preterm birth often refers to any baby that has been born before 37 completed weeks of gestation or pregnancy. Usually in Nigeria, my environment, the baby has to have been born between 28 completed weeks and 37 completed weeks, because 28 weeks is what we call age of viability, when the baby is likely to be alive after delivery. And between then and 37 weeks, you can now say that that's any baby born within that period is regarded as preterm. Of course, in other parts of the world, you have the age of viability being lower than 27 weeks. Even in our environment, because of technology and advances in perinatal medicine, we now have capacity to deliver babies even younger than that, and for as young as 24, 25, 26 weeks. But in other climes, ages of viability may vary out to 24 weeks. So between that age and the 7 weeks, we regard them as preterm babies. But for us, for now, it's still 28 weeks up to 7 weeks.
All right, Dr. Epundu, is there any difference between preterm and premature birth?
They essentially mean the same thing. Premature means being born before maturity. Preterm means being born before term. And what we regard as full term baby is a baby that is born between 37 weeks and 37 completed weeks and 42 weeks. So that's based on term. The term means the duration the baby ought to have stayed in the womb. But prematurity means that the baby is not yet mature for pregnancy. So mature babies are expected, babies that have stayed up to term are expected to be fully mature. So babies that are born before term are expected to be premature. So they're almost synonyms, even though they connote different things. But the fact that the baby is born preterm, it means that baby is likely to be premature, to be a premature baby.
Are all pregnant women at risk of preterm babies? Who exactly is at risk of this development during pregnancy?
So that's a good question. As regards risk factors, I would like to say that every pregnant woman is at risk of having a preterm baby. So more than the others too. But once pregnancy is established, it's that baby, until the baby runs the course required for full development, that baby is always at risk of coming out before time. Now there are factors that could be responsible for it coming out earlier than usual, recurrently in some people, in some women, and those factors have been well identified. They could be divided into different factors. Okay, some of them are maternal related factors, some of them are factors related to the baby, and some of them are also medical problems or non-medical. So based on the classification. But let's just give a few insights into some of them. For maternal factors, for instance, a mother that is hypertensive, wherein we have preeclampsia as major factor there. A mother that has pregnancy hypertension could have a preterm baby. Of course, if we talk about bleeding, antepartum hemorrhage, bleeding during pregnancy, these are all factors on their own. So then going forward also, we talk about the cervix itself. When there is a weakness of the cervix can lead to open prematurely and baby can come out. That's for the maternal factor. These are most other factors that exist. Okay, so the pregnancy, the size of shape of uterus, shape of the placenta, type of placenta the woman has, and also that. And then for the baby, abnormal babies that have more abnormalities of one type or the other, even babies that are multiple gestation, twin babies, triplets, quadruplets, those may come out earlier than usual. If they are malpositioned in the womb, they can also come out. So then, of course, the other things that can be medical conditions like hypothyroidism, the one that the hormone level is low, amongst other factors can equally lead to this. So factors are innumerable, but I think that's why having a platter of time will help to identify those at risk, and those have been having recurrent preterm and be able to address those issues and help them to have a normal full term delivery.
Okay, what signs should a pregnant woman should look out for now? Are there signs? When should you go to the hospital? How do you know that you are going to have a preterm birth or delivery?
So, there are a couple of factors one should, I think, look out for, be worried about, right? Well, I'm not an obstetrician, but I believe that we share a lot of knowledge together. So there are a couple of things one should be worried about. Preterm contractions, they begin to happen earlier than usual. Earlier than usual means that there are contractions are not necessarily lead to labor. But for once the woman enters into her second trimester, late second trimester, and even the third trimester, sometimes these things happen. So when the contractions happen and it's consistent, all right, it's something the woman should be worried about. Okay, now if a woman has a bleeding, drainage of lipo, drainage of fluids, or blood coming out from the vaginal orifice before expected, that should make the woman also concerned, right, and begin to get expect attention. So a woman that has hypertensive, that knows herself to be hypertensive, should not wait till late in the pregnancy before she starts antenatal. So for such a woman, if she knows her blood pressure is higher than usual, and that's also could be a factor I should be worried about, and be able to check it out at the hospital. So, but the typical things that the woman will see that make her very worried. One, there's an emergency situation. Typically, whenever bleeding and contractions, if this begin to happen when the woman is pregnant, she should not waste time at all. She should actually rush to the hospital and begin to and get proper review.
Are there complications this preterm babies, this set of babies experience? Are there actually complications associated with preterm babies?
So a couple of problems are associated with prematurity or preterm delivery. Like we all know, the fact that they are preterm means that they're likely to be premature. And that they are premature means that a lot of systems in the body are not very well developed. Some of them are not fully mature to handle existential life outside the womb. So I'll just deal with them quickly. One thing that's common is temperature regulation. So they tend to have a lot of temperature instability, and that will lead to death as well if it's not well handled. Hypothermia, very, very low temperature, or even hyperthermia, very high temperature. So that's because the subcutaneous tissue is still thin. The subcutaneous part is still not enough to protect them from the temperature variabilities. Similarly, when we talk about issues related to metabolism, glucose metabolism, because they are not mature enough, they also have a risk of hypoglycemia, abnormalities in blood sugar, things that relate to blood sugar levels. So feeding needs to be done appropriately and regularly in an appropriate manner in order to avoid the risk of blood sugar reduction or blood sugar changes. Then we'll also talk about infection. There are complications. One of the common complications they are prone to is severe infection, and that's because of the poor immunity that their reduced immunity that the body has, and because of the premature nature of their baby. So their immune system is not fully developed. So we'll talk about prematurity. We talk about infection. We talk about hypoglycemia or blood sugar issues. We talk about hypothermia. Also, of course, we also talk about brain development. Their brains are still not fully developed. And are risk of being challenged, depending on the level of prematurity. Really, I must say that there are premature level babies that are mild prematurity, there's a very severe premature babies. So those are the more premature the baby is, the higher the chances the baby will have more complications. The less premature the baby is, those are closer to 37 weeks. Those babies are able to cope better. So the complications are innumerable and they're quite daunting. Respiratory problems are there. ability to breathe well on their own is also there, because they don't have enough surfactants sometimes to be able to cope with all those issues. So yeah, they are all there, and big deals for us to deal with.
What about complications for mothers now? They are the vehicle that brings this baby to the world now, although earlier than what is expected. Are they going to experience complications too?
Okay, so for the mothers, the most important problem they may have to face to deal with is their problems are numerable. They have to do with the psychological issues they have to do, because they deliver the preterm baby. Psychologically, they may not be ready for, or they probably will not ready for that before then. Emotionally, physically, all this may be challenging for them. Of course, we talk about longer hospital stay. For them, the mothers, they have to stay in the hospital for long. Most mothers, when they deliver the baby, they want to go home and rest. The 9 months ordeal usually, but for them, of course, in a shorter time, they didn't stay up to 9 months, approximately carrying a pregnancy. So, but they end up spending almost compensating for that in the hospital. So they spend a longer time taking care of the preterm baby. The baby is mature enough to go home, especially if the babies were born very preterm. Then, of course, the other issues deal with ability to nurse the baby. Babies may be kept away from them for long in the incubator before they are able to get matured enough or well enough to now be nursed by them. Although this time around, we're also encouraging kangaroo mother care, being able to return the baby back to the mother on time, which is actually what the team for the year is even trying to encourage us to bring to fore. But for the mothers, is a whole lot of issues, both from the physical challenges they may face with expressing breast milk, because those babies cannot suckle directly, expressing breast milk for the babies to feed on, to up to the emotional and psychological aspects, which may deal with longer hospital stay, ability to understand that this baby belongs to them, which is very, very tiny baby, and being able to deal with that issue, the baby still requires to be taken care of properly.
Earlier, you mentioned that all women are at risk of preterm birth now. Are women that go through assisted reproductive technology also at risk of this? Do they have higher chances of experiencing preterm birth?
Yeah, so that's absolutely correct. Assisted reproductive technology tends to be a major risk factor for preterm delivery. Actually, sometimes it is not necessarily that the baby will not be able to stay to term, but sometimes the system is programmed that when the baby is just old enough or mature enough to cope with the vagaries of external life, even the obstetrician may encourage for the baby to be brought out, so that they will show that pregnancy was brought to completion and the baby is able to handle. So they may not stay to the 40 weeks. Once they're able to stay to 37, 38 weeks, most times they're able to come out sometimes earlier. Some other times also, what may have even led to the challenge in the first place, conception, may still be here, may still be a problem. So that may lead to threatened abortion, threaten the termination of pregnancies, and that may be one thing that may lead to early deliveries, so that babies can come out on time. The other factor also to consider is that once sometimes the parents on their own opt for that they want to be able to come out on time, so they will not have any issues delivery at 10. So all these are factors to be considered when the baby has be conceived through assisted reproductive technology. Yes, there are risk factors taken of that, and the system is designed to manage that for them.
All right. Is there anything that can be done to prevent preterm birth from happening? And are there lifestyles or are there measures to imbibe to prevent this development in pregnancy?
Well, I think the most important thing is good antenatal care, first and foremost. And first of all, let me start with raising a girl child in a healthy manner. A girl child who is not likely to be the pregnant mother in the future needs to be given all the support during her development and growth. So getting appropriate nutrition, getting folic acid supplementation, all the things they can start even before it's time for conception. Then by the time the woman is pregnant, all the support needs to be given to her, both from her, especially for those that are employed, from her employers. There ought to be a modification of her workload, so it does not get to be a problem for her during pregnancy. But of course, for the family needs to be able to support a pregnant mother, so that they will not have, she will not be under undue stress. Ensuring that she has good nutrition, ensuring that she has adequate support from the system. All these are factors to consider in ensuring that she gets the best of care. good antenatal care and early and prompt antenatal care, is very important because especially for those that already have risk factors such as hypertension, diabetes, all this already is in the woman, means that she ought to be very careful with her pregnancy and not take anything to chance. So the early commitment of antenatal care for such women will help to ameliorate this, and then also being able to have a high index of suspicion when you're having changes in your body that the woman doesn't understand. Such a woman shouldn't waste time. So you get to the hospital. Sometimes preterm contraction can be delayed. If it starts prematurely or earlier than usual, you get to the hospital on time. The doctors are sometimes able to abort it, and the baby still gets to be carried to term. And even if it's inevitable that the pregnancy will stop there, you know what to do to prepare the baby for normal life. So these are factors that I think can be looked into for preparing or preventing the preterm delivery.
All right, Dr. Epundu, tell us what care must be put in place for these kind of babies during this period. Can you please take us through the care or support for preterm babies now?
A couple of things must be put in place, really. It starts with having the right system on ground. The right system, I mean the right hospital support system, the right medical team on ground, the right set of equipments in place, and then the right set of policies put up by government to ensure that these people are well taken care of. So I'll start with the right kind of hospital system. The right kind of hospital system is one where they're able to have seamless and straightforward with minimal hitches to the process of care available for these babies, for their mother and for babies, wherein they will not have problems with respect to financing, health financing, and all that. So sometimes the babies are unable to get this care because they don't have the money, parents don't have the money to keep the appropriate care. So they end up languishing in some standard settings when they're not able to get appropriate care. Because similarly, that applies to having the right set of equipment. We should be able to have incubators in hospitals where at least hospitals that should be available to serve the populace, not just concentrated in one place, but reaching out to centers where people can have access to these facilities, and then be able to get care appropriately from the necessary specialists. Similarly applies to having the medical team available. Unfortunately, our environment is a bit difficult because of the nature of healthcare in Nigeria today, where a lot of people are, even the manpower, they're having the brain injury, people are leaving the country and all that. So it's challenging quite a lot, but there has to be a system that enables even the ones we have, the people we have, to get them trained on how to ensure that the best of care that these babies can get is available to them. And that's where kangaroo mother care can come in, where we don't have all the facilities available, such as incubators and all that. We can be able to at least make the most out of kangaroo mother care and teaching our lower cadre workers how to utilize it. So wherein they don't have access to incubators or more sophisticated facilities, what are you able to do to support the mother and her baby? What are the danger signs you should watch out to ensure that the baby does not have problems and the mother is able to cope with her baby? And of course, being able to provide the good health insurance cover for mothers that have to now be necessarily at the hospital and stay for long, so they can be able to cope with the demands of such long stay to make their stay not too difficult to handle.
I know this phase can be very overwhelming and challenging for families. What advice do you have for mothers, family members, in terms of support and care? At times when they give birth so early, they tell you, we need to do christening, we need to do that and all that. So what support should be in place? What advice, what is your call to action as we wrap up?
Well, it's a very trying period for mothers, for the parents, for the baby. Everybody's involved, of course, for the health workers. So I want to state categorically that every preterm baby is a human being and deserves to be given the best form of support and attention the baby can get. So the best chance the preterm baby needs, from any chance can give the preterm baby to survive, it must not spare anything at all. We have notable people that were preterm babies who actually came up and grew up to become very important people in our lives, to be life-changing experiences from them. And similarly, it's also a very trying period for the parents. I think everything must be done to support them emotionally, psychologically, and make them stay comfortable in the hospital, knowing very well that they may not go home on time, until the baby is able to come out from the newborn and be able to go home with them. So for those that end up having one problem or the other, that also has to be a way of encouraging them and letting them know that there is, of course, life beyond just the hospital, that the baby still has opportunities that he or she can cope with in life and then deal with favorably. So it's a teamwork, both on the part of government, on the part of healthcare workers, who are also sometimes stressed out by the work, but knowing that the ultimate goal is the well-being of the baby and ultimately the well-being of the family. And then it's also not a sprint, it's a marathon. Because even when the baby is delivered and then nursed and then eventually discharged, you have to continue monitoring and following up on the baby for the rest of the baby's life, but also up to a certain age. So knowing all this will make you know that the importance of continued validation, continued encouragement, continued support from everybody is no doubt very important for both the baby, the family, and the community at large.
Collective support for both mothers and babies as well as families is actually important at this time when nurturing premature birth. Dr. Nonso Epundu, consultant pediatrician, and Zenith Medical and Kidney Center, Abuja. Thank you so much for your time and expertise on the program. We really appreciate you.
Thank you so much for having me. We really appreciate the opportunity. Thank you.
All right, I have been speaking with Dr. Nonso Epundu, consultant pediatrician with Zenith Medical and Kidney Center, Abuja. He has been sharing his thoughts on premature birth, care for premature babies. Sound Health continues with trending health report from around the world. Please stay tuned. This is why we say thank you on today's episode of Sound Health. Remember, premature babies or preterm babies also have the chance to live. They only require adequate support for both mothers and the babies. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.